We've seen the linguistic criteria for the OET speaking section. Now let's take a look at the clinical communication criteria. Under this section, there are 5 subsections, and for a total of 15 marks. Each of those 5 subsections are out of 3. So let's take a look at what those are. The first one here is relationship building. So by relationship building, they're talking about rapport, attitude, as well as your empathy. This is often established pretty early on in the role play when you have your introduction and your greeting of the patient. However, it is important to maintain these things throughout the conversation as well. Second subsection there is understanding and incorporating the patient's perspective. So this has to do with when you're asking questions, when you are listening to the patient, when you are summarizing, that you're taking the time to incorporate the patient's perspective, ideas, concerns, and acknowledging any sort of behavioral cues. By behavioral cues, this might mean things like they express concern or worry or they have questions. Being able to recognize those and to follow up with either further questions or in some cases empathy or whatever is best appropriate in that scenario. The third subsection here is providing structure. So in that role play, we want to see that it is very clear the organization of the conversation. And as the doctor, it is your job to guide the patient through that conversation. And to do that, there are things like signposting. Signposting being when you are labeling what you will then go and talk about. And then other tools that you can use, such as guiding. Guiding being this general term for making sure the patient is aware what you are talking about. And then labeling, which is closely related to signposting, but basically identifying the things that will be talked about or that you have talked about. Another subsection here is the information gathering. And with the information gathering, this mostly comes when you are asking those questions. So some of the skills the examiners want to see are things like active listening. Basically, you are responding to what the patient says after they have provided information. Verbal responses, summarizing, asking those open-ended questions to prompt those responses, asking just generally for information, and then using follow-up questions as well. With asking for information, I said instead it should be asking for clarification there. So if something is unclear or needs further elaboration, making sure to probe further and ask those important questions. The final subsection there is information giving. So this is when you are actually providing that information. And a couple of skills and things they want to see is checking about the patient's prior knowledge. So whether that is providing information about a diagnosis or a treatment, checking in and seeing what the patient is already aware of at that point. And then just generally being attentive, understanding and monitoring their reaction throughout the conversation so that if things come up, if they have those concerns or questions, you are responding appropriately instead of reading through a script of all the information in front of you, actually making sure it is a conversation as opposed to a monologue there. So that is a summary of the clinical communication criteria. As a reminder, we have the linguistic criteria, and then we have this section here, clinical communication, worth 15 points in total.